Good afternoon. This is Amy Blaser coming to you from Columbus Community Hospital with another wonderful segment in our Let's Talk series. I have the privilege of spending some time and having a conversation with one of our newest orthopedic surgeons, Dr. Michael Pitner. Thanks for joining us this afternoon.
Absolutely. Thanks for having me on.
Oh, yes, we're going to have a fun time this afternoon. So anyway, Dr. Pitner, you are an orthopedic surgeon. So tell us a little bit about your specialty and your training.
Absolutely. So orthopedic surgeons take care of problems with the musculoskeletal system. We deal with anything from sprains and strains all the way to fracture care and arthritis in the joints. And so kind of a wide spread of different things that orthopedic surgeons take care of. For me personally, I'm from Omaha originally, so grew up there, went to the University of Nebraska in Lincoln for undergrad, and then came back to Omaha for my medical school training at UNMC. After that, I did my orthopedic surgery residency at the University of Kansas in Kansas City, and then did a year of fellowship training in orthopedic surgery sports medicine at FRIA Orthopedic Center, which is part of the University of Minnesota in Minneapolis.
And you've been practicing in Columbus now we're at a 1-year anniversary. So that time has gone fast.
It's been flying for me. It's been great for me to start my practice here. And I can't think of a better spot to be.
Well, we're very, very fortunate and blessed. And I'm very glad that you're with us, and not just for a year, but many, many years to come.
Absolutely.
So as an orthopedic surgeon practicing in Columbus, can you give our listeners kind of an idea, a general idea of what a day in the life of an orthopedic surgeon is like? Do you spend a lot of time in the operating room, in the clinic? And then are you out in the community as well with some of our schools?
Absolutely. So we're lucky where we get to see people in multiple different facets. I have clinic many days a week where I'm seeing patients, talking to them, trying to understand what their problems are, diagnosing them, creating a treatment plan with them tailored to their specific needs. And many times that doesn't mean surgery. That means conservative treatments that we can apply kind of immediately. Sometimes that does mean surgery. And so taking those patients into the operating room during my OR days and doing surgery, and then following those patients again post-operatively in the clinics again. Outside of kind of my clinical role in the hospital, and especially with my sports medicine background, I'm lucky enough to be able to get out in the community and cover many of the local high schools and college here, and deal with the athletes and the athletic trainers. And that's kind of the fun part of my job as well.
And I think for our community members and our listeners, unless you've had a student athlete come up through the local high schools of recent, we've really expanded our ground coverage for athletic trainers. So how have you found the athletic trainers coverage? And we're really lucky to have the trainers that we do. And again, the depth and breadth of their coverage.
Absolutely. I find myself very lucky to be able to work with the athletic trainers that we have. They're all experienced, skilled, have many years under their belt collectively. And to be able to be plugged into that network, they're really on the front lines of sports medicine and dealing with the athletes. And then when it gets beyond their scope or they have questions, we work on getting them into the clinic and being evaluated by myself. But developing treatment plans with them, and being able to kind of expand our reach to not just Columbus, but the surrounding.
The region. Yeah.
Absolutely.
Well, absolutely. Yeah. We do see many patients coming into our community from surrounding neighborhoods and communities and counties, just because, again, of your expertise and your partner's expertise.
I think Columbus is lucky because not only do we have all these different specialties available, they're all in one spot. And I don't think you see that very often in bigger cities, let alone the city the size of Columbus. And to have that convenience of bringing people all into one roof, getting comprehensive care, I think is a real benefit to the community.
So as you've started your career at Columbus Community Hospital, you've been well trained. You've had exposure in many different hospitals and academic settings. Our hospital has worked hard recently to expand our operating room areas and to bring in, again, technology that's going to best support all of our surgeons, especially there's some pretty unique equipment in our OR to orthopedics.
That's the nice thing about orthopedics is it's constantly evolving, whether that be implants and components, whether that be our understanding of injury and marrying kind of the understanding and the great new innovations that we have. We really have cutting edge equipment here that allow the orthopedic surgeons here, including myself, to do more minimally invasive procedures, hopefully cut down on rehab times and still do them safely and reliably like they've done. I think we're constantly trying to push the boundaries on how minimally invasive we can get, how far we can push things like arthroscopy, endoscopy, while still getting great results and robust care and treatment. I see that continuing on into the future. I think many more procedures probably could be done on an outpatient basis, which is what most of our patients want. They want to be able to get the care that they get here and then still have the comfortability of being at home.
Yeah, there's no place better than in your own bed when you're trying to recover or when you don't feel good. So, and Dr. Pitner, a little fun fact that many of our listeners may not know is you're not the first physician in your family. So I always love to tell that story. So
yes, we come from somewhat of a medical background. My grandfather was a practicing orthopedic surgeon, now retired. My father is still practicing orthopedic surgery, and I have a couple other aunts that are anesthesia and pediatrics. My mom, my grandma, my wife, and everyone in our family otherwise is nurses. And so we always joked it was a reasonable family to get injured.
You could almost start your own little mini hospital. So
if you look in our basement, it's a little bit of a MASH unit sometimes.
I love that. So of course, you have taken the route following your grandfather and father as a physician. But if you wouldn't have taken that route, was there ever a doubt that maybe medicine wasn't for you?
I think I knew pretty early on that I wanted to go into medicine. I had the ability to shadow them and their colleagues as well, and really enjoyed that aspect of it. I think if I didn't do medicine, I've always liked the teaching side. There's been so many influential teachers in my life to get me to where I've been. And I've always really enjoyed that aspect of things. And so I think if I didn't go through medicine, I'd probably maybe be a high school or college teacher.
Well, I think you would be excellent as a teacher as well. Let's talk about teaching and patients. So a lot of what you do as an orthopedic surgeon is talk about prevention as well. So preventative measures that as we age, we can stay healthy orthopedic wise.
Yeah. I tell my patients that our knee joints, and especially the patellofemoral joint, the joint between your kneecap and the end of your thigh bone, sees about 5 to 7 times your weight during flexion and loading. And so every 1 pound of weight loss is 5 to 7 pounds off the knee. Just sort of reassuring thing for patients. But health is so important, and preventative care in orthopedics is so important. I think we've gained an understanding that bone health affects so many other aspects in the body. So even non-surgical bone health, things like getting screened for osteoporosis is important. Vitamin D screening is important, and getting vitamin D supplementation if you're low is so important in bone turnover and bone health and preventing injury and trying to keep you out of my clinic.
Yes, so we'll see you in the stands at the football games instead of in the ER, right?
Exactly. That's my hope.
Yes. So as you and your wife have settled into Columbus, what do you think of our community so far?
We love Columbus. I think being 3 minutes down the street from the hospital is a great commute for myself. Megan is constantly out on the running trails and just loves the town. It's, we came here for the job opportunity, no question, but for the people, really. We really have enjoyed all the people we've gotten to know here in Columbus. I'm lucky I had a little bit of a background, having had family grow up here, having good family friends, making the drive between Omaha and Columbus not infrequently. So living here now has been a lot of fun, really great for us.
So what do you enjoy to do when you're not practicing medicine? You're not on call. And again, you're on call. In our community, you live and work with your family here. You take orthopedic call during the week and on the weekend. So even if a patient doesn't have a routine scheduled appointment, if there is an emergency, we have you and many other well-qualified physicians on call to manage the ER. But when you're not on call, you're not practicing, what do you enjoy doing?
For me, anything outside.
Outdoors.
Yep, outdoor activities, anything from, the benign, banal stuff of mowing the yard, lawn care, all the way to going out, having walks, bike riding, fishing, hunting, and really anything, any sporting activity.
So anything outdoors. Keep that spirit going. When we think about, coming into the clinic, talk a little bit about the clinic experience. You've got a really great team.
I think the first face most people see in the clinic, for my team at least, is my nurse, Allison. She is great. She will check folks in, take some vital signs, start to get a feel for what's been going on, what they've tried, take a kind of a brief history. And she not only does the front end stuff, but does a lot of the back end coordination with other teams, referrals if need be, setting up surgery schedules, kind of enacting plans. And so she's great. Michelle is one of my athletic trainers that works with me. And for a sports medicine physician to have an athletic trainer be in clinic and be seeing these folks with me and seeing that side of making the plan, understanding the goals of these athletes, and then having that communication from athletic trainer to their athletic trainer at their school makes everything seamless. The transition from the care in my clinic to the care they receive at their school is important.
Definitely wonderful for the student athlete, but even more reassuring as a parent, also very, very helpful and supportive for our coaching staffs and the athletic directors and school administration. So just keeping everyone on the same page.
Absolutely.
If you have ever been a student athlete with an injury or been a parent of a student athlete with an injury, having that team is different. It is.
And then Kay is my nurse practitioner that works with me in clinic. And so A supports me when we're seeing patients, and then starts to seeing some of my patients independently on her own, and kind of helps me extend my reach, just like the rest of my team, to be able to care for more and more people in the same quality manner that we'd like to.
Can you reflect and maybe just share a high level kind of a story about a patient that you feel that you made a difference in their lifestyle, in their course of care?
Yeah, I'm lucky where I get to take care of kind of a wide spectrum of patients in terms of age, activity level, all of those things. Being sports medicine sort of focused, I love my young athletes, and seeing some of the young athletes that I'm able to take them from when they've been injured, say an ACL injury or even just an ankle sprain, and be able to get them back to their sport at the level they were doing before is really special. And I think a unique opportunity for me to be able to see that happen.
It can be very life-changing. You only have a certain number of years in junior high and high school for the majority of athletes, unless you go on to play the sports you love. And it can be a life changer when an injury puts you on the sidelines and takes that opportunity away from you. So being able to return to play safely and get those athletes back, and not have to travel out of town to get high quality care, and that's huge.
I think for athletes, having somebody that's been through this before, taken other patients through this, and having a partner in their healthcare through each step of the journey is so important. I think the unknown is what's the most scary for many of my young athletes and patients in general.
Yeah.
And so being there for them, helping to explain what are the next steps, what do we expect as we move forward, is really rewarding for me.
How do you approach a conversation, Dr. Pitner, with patients when recommending lifestyle changes that might be challenging for them to adopt?
Explaining the why. Why do I care about your obesity? Why do I care about your tobacco use specifically, not just for the general health, but for the surgery or the care that we're talking? And I think creating an environment for patients where they feel comfortable.
How do you balance conservative care versus injections versus a candidacy for surgery?
Part of that is understanding the patient's goals and the patient's functional goals, and aligning treatment to that. I tell almost all my patients, I try to manage their problems non-surgically as often as I can, as long as we can get them to good pain control and good function. When we have tried activity modification, medications, injections, therapies, brace wear, and they're continuing to have pain and they're continuing to have dysfunction, that's when we start to talk about surgical options. And so that's my algorithm for that. And then lining up, like I said, the patient's goals for return to function to a tailored treatment plan where we employ some or all of those leading up to a surgery.
Has there been anything here that, as you've started your practice at Columbus Community Hospital, that was a positive unknown?
I was lucky. I had a pretty good
Yeah.
idea. I know we had talks
Yeah.
and talks with other members of the hospital. I think I was pleasantly surprised how comprehensive things were. I think I was also pleasantly surprised on not being complacent in that we have things pretty good right now, but we're always looking to the
Always looking for the future.
cancer center, whether that's bringing in athletic trainers, which happened right as I got.
Absolutely.
It's a constant focus on keeping things good now, but also planning
for the future.
You have imaging in your office, but we also have state-of-the-art imaging in our hospital. And I would be amiss if I didn't give a shout out to that technology, because again, we've invested in really wonderful technology, but also even more fantastic radiologists here locally as well.
Yes,
So,
absolutely.
yeah.
We work with the radiology team almost every day, and we're on the phone talking about, this is what I see, what do you see? And so it's very collaborative, which is nice. And then the technology is great. Again, it fits that same story of bringing everything under one roof, whether that be X-ray, CT scan, ultrasound, MRI, any modality that I would need is found here. And so keeping that care within the same community where we don't have to worry about losing images or clouding images, it's all right here, is so helpful.
And again, we're very fortunate to have a foundation that has allowed our hospital and community. It's been a great catalyst. Every year we have our annual golf tournament, and again, just from many generous donors over the years that have given to our foundation, have also helped to fund special projects.
I think the field house is a wonderful example of the gift that the hospital has given back.
What do you think about our field house?
It's amazing. It's such a great facility. I've had patients talk to me. I've had family members come into town to visit, and they are so impressed with the field house. And I think it's something our community should be very, very proud of, because you don't see anything like that in Nebraska, let alone the region.
Especially because we do enjoy 4 distinct seasons. And for the seasons, we can't always be outdoors enjoying and getting exercise. And so the field house offers something for everyone. So,
and for every season.
For every season.
Well, Dr. Pitner, it's been a pleasure, as always, to sit down and talk with you. And we look forward to following your career. And we're just, again, hope we don't see you in the emergency room, but we'll see you in the clinic and out in the community. And we're just very grateful that you chose Columbus Community Hospital for many years to come. So thank you.
Thank you for having me on today.